That's a French award, Pony International Player of the Year.
Tony Ward is one of rugby's great fly halves. Capped for Ireland 19 times, scoring 113 points, he has plenty of good memories. But the toughest game of his life has been against prostate cancer. He was diagnosed with an aggressive tumour picked up by chance, and even now, more than a decade on, he still needs daily treatment and regular scans. If only there had been a screening test.
We're so quick to put our car in to get checked up every so often, but very slow to do anything ourselves. I did not have the early diagnosis, but I got away with it by the skin of my teeth.
Now, Ireland is one of the first countries in Europe to test prostate cancer screening as part of a pilot study funded by the EU. 8,000 men in their 50s and 60s are being invited to take part, starting with a finger prick blood test that measures their levels of a prostate protein called PSA. It's a test that in the past has been controversial.
The PSA test isn't reliable enough on its own to screen large populations. It misses some men with cancer, but it also flags others as having cancer when they don't. The study here in Ireland is trying to make screening much smarter.
Men with raised PSA levels will have a detailed MRI scan of their prostate, particularly if they have black ethnicity or a family history. The doctor leading the study says the strategy should make screening more accurate and cheaper.
In effect, there is essentially a tsunami of elderly patients coming towards us. There's going to be a sharp rise in prostate cancer. Unless we have a way to detect the disease early and not burden our healthcare services with vast numbers of scans and biopsies, we have to take a very sensible approach to this.
In the UK, government advisers have already spent 2 years looking at the evidence on screening, and there's still no decision due until the end of this year, to the frustration of cancer charities.
12,000 men die every year from what is, when caught in its earliest stages, a very, very curable cancer. And we think the evidence is there, and we can't see why this has taken so long. Men are dying while we wait for an outcome.
High-profile men like Sir Chris Hoy talking about their prostate cancer has encouraged more men to come forward for testing. But while Ireland assesses the effectiveness of screening, the UK still has no strategy for hunting down what is now its most common cancer. Thomas Moore, Sky News in Dublin.